Hi friends, welcome to part 3 of medicine paper 2. There were a few things which were left much in part 2 of paper 2 of medicine. So I thought I would discuss those questions also. Make sure there were a few things even in paper 1, for example, genetics, then acute illness, and also a few parts under toxicology which I had left. I've added those. I don't think it requires an explanation, and also few 3 markers under cardiovascular system. I've uploaded the notes in the description box. I feel those are self-explanatory. But if you still want a video, you can just ask me. I will do that. But in paper 2, majority of the infectious medicine part was left. So I thought it was better if I explain it once. So now, firstly, we'll go with pleural effusion. Okay, this was also one of the things which I left in that part. So one of the important topic itself, pleural effusion. Again, you need to know about the Lights criteria and how do you classify it under transudative or exudative. Again, the major clinical features and signs again go with the same things: inspection, palpation, percussion, and auscultation. Highlight the important things so that you know you're presenting the same thing which they expect you to know. And again, Lights criteria, in and out of it is important. So when do you say it's an exudative or translative is something which you need to know. Then again, what are the important things which you need to mention about the management is something which they expect you to know. And this is one of the flow chart which they have given on how to go about in the case of pleural effusion. Okay, based on whether it's translative or exudative. Okay. uh, and chylothorax, obviously, majority of it is basically you need to check out whether it's a malignancy related thing or whether it's a trauma related thing. So basically you need to drain it out, but long term has to be avoided because what is it, it's a protein, so it might cause malnutrition. So that is one of the important thing. And again, causes of mediastinal mass was something which we had left. So again, what if you know anatomy, obviously you divide it into uh, anterior, middle and posterior, and also superior is something. And so based on the organs which are there, you can place the disease and come back. And again, this is once that asked is for RS2. So I've just mentioned it. The basic thing is you have to treat the associated disease and give analgesic. This is what is being done. But what happens is that this is the major thing is they look. Again, it's a RS2 question, but if you just want to see it, if you just want to go through it, you can go through it. Again, hemophilia ITP is something which I told in pediatrics that will be discussed under medicine. So I've just kept it here. So again, hemophilia, again, it can be mild, moderate, severe. This is on, again, factor 8. Based on factor 8 level is how you make a diagnosis, and also the clinical features and when the patient present. That means the kid present. So it's a core pediatrics topic, but since it's also being asked as an RS question many times in medicine, I'm discussing under medicine here. Okay, then basically you need to highlight everything. Again, while writing investigation, please follow the same order like how we have followed to confirm the diagnosis, to treat the disease, and to come for to look for any complications. And again, here you can write about the prevention. Antenatally, you can also do a chorionuclear sampling or amniocentesis, and you can come to a diagnosis also. Then again, these are the first aid measures which you can do. Then again, these are the proper measures so that you can prevent the disease. Again, these are the prevention. Always while writing management, prevention has to be there. Okay. Then again, what are the causes of generalized lymphadenopathy? Start with infection, then autoimmune, malignancy, and systemic. Okay. Then thrombocytopenia, again increased production or increased destruction. Based on that, you can place the disease and come back. Again, TTP also. Again, pentaid of TTP is something which would ask with how do you go about the treatment. So I think even if you just go through it, it is self-explanatory. Then again, DIC, major important things. Again, you need to highlight and come to a proper conclusion. Okay. Then again, how do you manage it? And again, complications of sickle cell anemia they have asked. So again, divided into infectious and non-infectious. Again, in non-infectious, again you can add due to drug overload. And again, other complications like in CNS, in leg. Basically, you need to talk about ulcers, and also if she's conceived, you can also write about FGR and spontaneous abortion. And these are the drugs causing agranulocytosis. Never miss the sulfonamides and linezolid. And again, and after that, again, immunoglobulin uses that as again divided into autoimmune cause, infective cause, and all those things, and present it accordingly. Here, I have just given you an overview on how, what are the causes of it. Again, indications of anticoagulant, obviously, again, divided surgical, non-surgical. Again, non-surgical means medical. So again, for that, you can write for thrombosis and others, so that you can present it in a better way. In Philadelphia chromosome, I don't think I need to mention because I know you are studying it from pathology itself. Again, now coming to the infectious medicine part proper. Again, PO I had written, but I was not convinced by the answer which was given in Davidson. So again, I posted this thing, so that again here it's a flowchart on how do you go about it. First you need to confirm the diagnosis, then again you have to check for if it's that is PET CT, and you have to check whether you can find any source of infection or any source of cause of fever. So based on that, you need to come to a proper diagnosis. That's what they meant in that flowchart. And enteric fever, there I have not written it properly, so I'm mentioning it again. You can just refer these notes. Okay, then again, the major thing is any infectious, one thing you have to write is about the fever, and also I need to talk about the pattern of fever. And I am sure everybody know it's a step-ladder kind of fever which is there in enteric fever. And also again, you can write about the complication part. Again, three important things. How do you write clinical features? Again, general and systemic, and again you can write clinical signs, which I have mentioned here. Okay, and again, complications. Okay, complications, again, it can be general, intestinal, and extra intestinal. Okay, so place it accordingly and come back. Again, treatment, you have to talk about general, you have to talk about IV fluids, you have to talk about antibiotic, and also you have to treat to talk about complication. And also important thing is you have to talk about carriers and how do you prevent it. Okay, all these things are important because it's a 10 marker, so prevention is the major role which you need to talk about in every disease. Okay, and again, dengue fever, again, these are the phases which you need to remember: febrile, critical, and again, you can either go into improvement or you can die. So that is nothing but recovery phase. So based on this, again, these are the signs and symptoms, and these are the complication. Again, general and systemic, and again, majority of the things are being highlighted here. Okay, even if you just go through these things, I think it should be enough. And again, how do you go about the treatment? Again, you have to divide the patient into whether the patient is in mild, moderate, severe. I mean, whether he has warning signs or is already in complication, or there are no warning signs. Then based on that, you can obviously place the disease accordingly. What is the major important thing test which you do is hematocrit. So a major thing which you are worried about is the third space fluid loss which occurs here. And again, dengue shock syndrome, again, you can just go through it. In malaria, obviously, majority thing which they have asked is about the complication. Again, this is WHO 2000 guidelines which mentions about the complication. Again, with conjunction with that, you can also study about the cerebral malaria also. Okay. Again, they have asked what are the chronic complications also. So make sure you mention this also accordingly. Again, the same investigations and treatment protocol, I'm not talking about that. And again, leper reaction, again, I hope you know the rule of 5. That is, whenever you add that, it should come up to 5. So 1 plus 4 equals 5. So 2 plus 3 equals 5. So that is type 3 hypersensitivity. This is type 4 hypersensitivity. I am sure everyone would have known by now by this time. So again, they might ask you difference between those things, or they might ask you about how do you manage these conditions. Again, treatment part is something which they are very concerned about in asking. Okay, so based on that, again, you can study it accordingly. Okay, and how do you go about multibacillary and paucibacillary treatment? Okay, then pneumocystis jirovecii, I have just written the treatment. Again, I don't recommend you to remember this alternative part because remembering this itself is much. Okay, so you can just mention about this. Okay, that is more than enough. And how do you start a prophylaxis is also something which they have asked consistently. Okay, so you can mention about that also. Prophylaxis is something which is actually important and you need to mention it. Okay, this is one of the most important question which they ask you, that is how do you what are the pulmonary manifestation of HIV patient. Okay, so this is one of the most important thing which you need to remember, so please study it. Okay, again, I recommend you to draw a graph and then write CD4 count and then place the disease of what are the diseases which are coming. Okay, And again, ART in and out, especially about the pharmacology part of ART is being asked. So I've just placed only three things so that you can remember it also. Then PEP of HIV, that is post-exposure prophylaxis of HIV, is super important. You should know how to deal with it also. Okay. This, I think even if you just read it, you'll be in a position to understand it. So I'm not explaining much. Again, in CNS, I had left about the Jacksonian epilepsy and classification of seizures. So I've just mentioned it accordingly. And also the post-exposure prophylaxis of rabies is something which is important. And sometimes they were asked about pre-exposure prophylaxis also. So I mentioned that. In that, you just give vaccination, but here you give based on the category of the wound, you give both vaccination and immunoglobulins. Is something which I want to emphasize because this is asked in and out. I am sure you would have studied in community medicine, but I want you to study here also because this is super important, and I feel this can be a 3 marker this time. Okay, so it's important question. Okay, and also a few things, and the psychiatric part is also something which they are testing again about substance misuse and dementia, delirium tremors. Again, if you read it, it should be your, and also conversion or dissociative. They won't give you case, but these are RS2 type of questions, so I've just included it. If you have mentioned, if you have studied that part, I think you should be in a good state to pass. But for the sake of completion, I've also written all RS questions. Okay. So again, Wernicke's encephalopathy. I know all of you know the triad of these three: global confusion, ataxia, and ophthalmoplegia. How do you go about it? This is something which is important. Okay. And again, ITP, which we had missed again, it's an in a chill and we don't do anything. We just wait until the platelet counts fall below 50k. But in chronic cases, we need to plan it accordingly, and we need to check whether we should start on steroids or not. Okay, that's it with paper 2. I think we have covered majority of it, but my advice would be to go check back your paper 1 medicine and also ophthalmology part. Few are 3 marker things I have just added so that we have a proper conclusion or proper understanding of it. Okay.